Are you trying to taper off of one of your psychiatric medications and you're wondering what's the difference between a cut and hold taper versus a microtaper? Then this video is for you. My name is Dr. Ruth Dotton. I'm a board certified adult psychiatrist, and I talk a lot about the importance of providing full informed consent when starting a psychiatric medication, as well as principles of safety prescribing. As we've talked about in prior videos, when it comes to tapering off of psychiatric medications, we recommend a hyperbolic rather than a linear taper schedule, which means that rather than decreasing by a set amount or dosage each reduction, you're going to reduce by a percentage. So usually we recommend starting with around 10%. So if your dose is 100 milligrams, then we would decrease to 90 milligrams and then to 89 milligrams. Of course, this can be slowed or escalated depending on the tolerance of the individual. So there are two ways to do this. The first is going to be your cut and hold approach. This is probably easier just logistically, but there can be increased risk of difficulty tolerating the taper with this method. So let's say that the goal is to decrease by 10% over a month. So then you would cut from, if it's a 100 milligram tablet, you'd cut from 100 milligrams to 90. And then you would just hold it at the 90 for the whole month. And so you might experience similar withdrawal symptoms in the beginning of the month that will gradually improve as the month goes on. Now, in contrast with a microtaper, you may still have that same goal of decreasing by 10% over the month, but rather than making a cut and holding it, you're gonna split that 10 milligram dosage equally over the 30 days. So you're gonna be going down by a third of a milligram per day. And so the idea being that you're gonna decrease your risk of having withdrawal symptoms, and it'll be a more smooth transition. Now, both of these can get you to the goal that you wanna get to of decreasing by 10% over a month, but for those who've had a more challenging getting off of their psychiatric medications, doing a microtaper rather than a cut and hold may make this process easier and make them more likely to be successful. Think about it as if you're coming down from a second story building, jumping out of the window from that second story, or going down steps to the ground level. So if you've tried both or either of these, which have worked better for you? And of course, logistically trying to get the microtaper to those really small increments can be quite challenging. So if you have tips about how to do this, I've talked a little bit about this in some other videos, but if you have tips about how to do this outside of using a compound pharmacy, which a lot of people can't afford, I'd love to hear about it. So please share in the comments below. Wishing you all good mental health today, and I'll see you in the next one.